Time now for this week's Health Matters. Paul Critz with you, along with PA Physician Assistant Lynn Szabo. I always shorten it to PA, and then I forget, we got to do this every week. Maybe somebody doesn't know what a PA means.
Yeah, well, the PA profession self-identifies as PAs because, I don't know, it sounds cooler.
It sounds cooler to be a PA than to say it all the way out. Yeah.
I'm a PA.
So today's topic, I'm totally in the dark about. What exactly is functional medicine?
So I feel a little wobbly on it too, I have to say. But functional medicine is a form of alternative medicine that was created in the early 90s by a guy named Jeffrey Bland. No, not an MD, apparently. And it proposes a different model of disease that's kind of in opposition to regular medical thought, is what I would call it. It's hard to call it traditional medicine, but the kind of medicine that you could expect to interface with if you were at one of the clinics or the ER. So, and I'm unclear, actually, how much of this is they're just relabeling everything and trying to put a different spin on it, or is this a really paradigm and a different way of looking at medicine that could be helpful for people? Okay. So that's the part I'm wobbly about. But this model is based on three basic areas of information. So the first thing is antecedents, which is their word for the underlying causes of disease. Mm-hmm. Okay. And I think the kind of medicine I practice would call those risk factors.
Okay.
And then there's triggers, which is the immediate cause of the disease. Mm-hmm. And that might be stimulating events or something. And then mediators, which are particular characteristics of this person's battle with disease.
I'd like to dive in, if we could, just a little bit, so I can understand antecedents. And you have described an antecedent as underlying cause of disease. How does an underlying cause of disease differ from an immediate cause of disease?
So that's kind of vague, actually. That's one of the criticisms about this kind of medicine. But what I would say is that would be like a genetic predisposition. That's the only thing I could.
Because you termed it, talking about, you said you'd call them like risk factors.
Or risk would be like gender or age or.
And this is just words, not medical knowledge, but risk factor is something in my mind that's passive, that's waiting to be sort of actuated. Right. Exactly. Whereas a cause is something that's active. Even an indirect cause would be an active thing. Right. So I'm
but
lost
it's
already.
Also active and passive at particular times in the timeline. But that's one of the criticisms of this kind of medicine is that it's super vague.
What's the goal of this kind of medicine? What exactly?
I think it's to get personalized understanding of somebody's disease process, and then help them with a depth that medicine doesn't traditionally get. Okay. But I also think it's to sell things.
Oh, okay. All right. Okay. Darn. All right.
Or it's to get your political views put in without. I'll get more into that.
Okay. Yeah. Let's jump in further.
So we have antecedents, which I think are risk factors, triggers, which are immediate causes of disease. So that. And then mediators, which are particular characteristics of disease. We would call that symptoms.
Okay.
Signs and symptoms. And so based on these three factors, a practitioner, not necessarily a physician, which I could say I'm not a physician, but these are practitioners of functional medicine there's no limit on who it could be. It could be a physician.
There's no like board certification for any of this or anything, right?
Kind of, it's developing.
Okay.
It's kind of sketchy. So this practitioner derives a matrix, which looks to me like a treatment plan. So, and I can see some, like I said, relationship between current medical knowledge and the way, the kind of medicine we're used to relates to this. But there's problems with this school of thought. I think there's big problems. So the first thing is there's not really a reliance on scientific rigor. Okay.
I guess can you help me? And I don't know. This may be beyond the scope of this show, but is there a way to even understand, like in a hypothetical sense, if I were to go to a functional what do you call them?
Medical provider,
medical provider, that with a particular with a specific sort of something complaint. How does that work? How does that play out exactly? Let's say I go and I've got I don't know, I've got a cough or I've got the sniffles, or is it for different sorts of things?
I think it's for more vague stuff. Usually people are frustrated with their own attempts at medical care and they don't really get an answer that's satisfying to them.
Okay.
So one thing is you've got this person who's diving deep into your medical history with a fresh view. Mm-hmm. So I think that's kind of attractive. They do spend a lot of time talking to the patient, like an hour. Mm-hmm. Okay. And they really dive for details. And then it kind of caters to, I think, that part of medicine where we want it to be personalized to us, that becomes really important.
Right.
And we want it, I think, to be a little bit easier, like, maybe somebody has diabetes because they have heavy metal toxicity in the school of thought. And it's easier to just pay for this, heavy metal cleanse than it is to actually do exercise and watch your diet and, check your blood sugar and all that. So it's a little bit magical, I think.
Okay.
And so what happens a lot is they go through this really in-depth interview process. They order a lot of testing, which seems obscure and unnecessary to, say, a practitioner like me. Mm-hmm. Okay. And then they arrive at a conclusion that's not super questionable scientifically. Mm-hmm. Okay. So, science goes around trying to prove itself wrong. Mm-hmm. I don't think people realize that about it. And medicine is a big thing. A big thing is rule out. And so people get this kind of vague, not reproducible idea of what's wrong with them. And then at that point, it's getting expensive, right? Because insurance doesn't recognize this as medical practice, mm-hmm. and they don't pay for it. Mm-hmm. And so oftentimes people get bounced back to their regular provider at this time, and they announce that they're tired because they have heavy metal toxicity. And the provider sits there and goes, well, your thyroid's not normal. Mm-hmm. Could we look at that first? Because that's easy to fix. Okay. So all I could get on this was vague, which I think is why you're making that face. It's
because I am not. There have been no answers given to me from all of this. I'd like to know, but I think maybe because I'm trying to think of it as an actual a way of managing health and healthcare and medical care, but really, this is just hokum, right?
Yeah, that's what it looks like to me. But there are some people who, some people who we follow, like mm-hmm. the Cleveland Clinic, for example, has a functional medicine clinic. Right. George Washington University has a functional medicine clinic. But the American Academy of Family Practice Physicians you can't go to a conference for it and get continuing medical education.
Wow.
So I think what's going to happen is, maybe this is cart before the horse, but is that there's going to be a lot of arguing about it. We in the kind of medicine we do will take away some important lessons, but I don't think this is going to be the answer to people's problems.
Is this just another reworking of the old like traditional medicine, Western medicine, holistic medicine sort of divide?
I think so, but I think it's a little different in that I think it just puts a different spin on things mm-hmm. and comes to what might be a financially appropriate thing for the person who's practicing. So that would be snake oil.
I was going to say, but throw in snake oil into the equation. Exactly. Okay. All right. I think we're on the same page.
I think as patients, there's this desire to make this all easier, mm-hmm. to make it more understandable, to make it seem like it has an endpoint where disease is not only going to be resolved from, causing further damage, but also repairing damage. I see that a lot in like people with osteoarthritis. Then they want to know how they go back to having like the knees of a 7-year-old. And that's like, I understand they want to feel better. I totally get that. But we blink at each other for a couple seconds and I'm thinking, this isn't fixable.
Yeah.
In the way that you're expecting. So I think people kind of want that. They just want this one thing, fixed. And then they're going to go back to excellent health. And that's not really the case because you're looking at diseases that are probably not fixable like that.
Right. Best case scenario is that we've stopped what's going on and, you're left with what's left.
Right. Or here's some coping mechanisms,
Right.
And that's, as an aside, that's kind of what's going on with chronic pain treatment right now. We're giving people chronic pain toolboxes and the provider's actually involved with like 2 of the things in the box or 3. And then the other 17 or 18 is on the patient. So the patient's supposed to take a way more active role. And that's frustrating for them. That's like, you're not doing anything for me.
Right, exactly.
So,
it also seems like in a scenario like this, just from the little that we've discussed so far, that it really leans into the desire of the patient to have that human interactive connection with their medical provider.
So that's what I've been thinking about in my frustration all week, like reading articles on this and thinking, what again? I don't understand that. But trying to draw why a patient might be really attracted to this.
Yeah.
Because it happens all the time, is that we get patients who go to alternative medicine practices in general, and some I suspect are functional medical practices, and they'll come back to me and say, well, they told me my hormones were out of whack. And I'm like, I don't know what to do with this. And then they're looking at me like, hormones, you know what hormones are. And I know, but I know you have thousands of them.
Yeah, right.
I know it's way more complicated than what you're saying, and I'm not sure that that's actually your answer.
Yeah, and it seems like in an instance like that too, it could muddy the waters. It could make it more difficult for a provider to get to the bottom.
Yeah, completely. And, as a courtesy at UIHS, and they probably do it at Open Door and Del Norte, we sign lab orders for alternative medical professionals so that people can get their labs drawn through the system, so it's covered by their insurance, or it's more convenient. They don't have to go to Medford to get a lab drawn.
Even though the person dealing with the results of those labs aren't in the network or part of traditional healthcare. Wow, that's really nice of you guys.
And then they bounce the results to me, and I'm supposed to interpret them, even though it's not. It's like Martian.
Well, yeah.
I'm like, what? What again? What? Huh? So, but here's the deal. I see this as kind of a place where, like, providers who are burning out, science is kind of burned out on this whole COVID thing. We're tired of explaining ourselves. We're tired of people arguing with us in ways that seem nonsensical to us.
Right.
And a lot of providers in general, when they get burned out like that, they niche. So they go into women's health, or they go, I'm raising my hand. I'm kind of doing it. It's kind of happening to me, but I'm also letting it happen. And to go into alternative medicine when you're a slightly burned out provider is, they're showing up in the community and the regular medical structures, and people have access to their care.
Yeah.
Okay.
Yeah.
So that's where, on a national level, this is showing up as available at the Cleveland Clinic on George Washington. But it's also happening at a local level. People are going to these conferences, even though they're not getting CME necessarily for them, because it's not recognized in the more, kind of medical practice we have here.
Right.
So I'm kind of getting off topic, but but what can this teach us about what patients want? Which is, I think, the most important thing.
Yeah.
So what patients want is
FaceTime.
More FaceTime.
Yes.
And what they want is to be able to talk about their particular situation. So, I've said before, when I'm doing acute care and I'm seeing a ton of patients during flu, say if I see 65 in 10 hours, that's like 60 people with the flu. They don't want to be seen like that. They want to be seen as an individual that has this problem, and they're hoping that you're not just in some kind of rote place, not really thinking about their medical care, and just, you've got like 100 prescriptions for cough syrup in your back pocket and you're just handing them out.
Right.
But that really is what's happening in that situation. But if somebody's tired, like that's such a non-specific complaint, there's like hundreds of things that could play into that, but they don't want to hear the complexity of it, especially if it's hard to fix.
Yeah, right.
They want to hear it's this one enzyme, fix it and I'll be better. And so the other thing I noticed in functional medicine, and I see a lot in alternative medicine, is that if the only tool you have is a hammer, then everything looks like a nail.
Exactly.
And so even in their individual, their claim to having an individual evaluation, they're actually, everybody's the same. So as an example of that, one thing I read was some functional medical practitioners think that 25% of the United States population suffers from toxic metal levels. And that's what their healthcare problem is. But I've only seen one of those in my entire career, and it wasn't, she didn't get sick here.
I was just thinking of, when you were saying that, I can see why people who don't really pay that much attention or think in depth about how science works could think that, and could think that's even a possibility. Sure, with the environmental degradation that we have to face all around us all the time, with the fact that history is littered with things like, the green dresses from the 19th century killed women and nobody knew about that, and the radium girls and things like that. And so you turn around and go, well, yeah, that's happening all the time. Of course. You just don't know it yet.
That's a little conspiracy, I think. But science wants to know that. So science studies that.
And science found it out after the fact because science at the time couldn't.
Yeah, because that's how time rolls.
Right.
But think about all the all the conspiracy theorists who have ideas about what the vaccine for COVID really did to us. Messenger RNA vaccines. What did it really do to us? They are landing here.
They're sitting on our city council and board of supervisors and saying it out loud.
They're landing in this kind of medicine. So it is possible to go to a provider in this community and
have them agree with your conspiracy theory about it.
Super like crazy and scary, I think.
Oh my
because
God.
Do we have to say it? There's no scientific proof that that's happening.
No, but that doesn't matter because the ordinary layperson can't tell the difference between scientific proof and something that's been fashioned to look like scientific proof.
It feels easier to blame whatever your current problem is on a vaccine or toxic heavy metals, and not that you ate too much birthday cake for like 10 years.
Or separate from it, you having any involvement, even accepting just the ignorance of we have no idea how this came about. It's much better to go, well, here's a cause, and now I can put that, I can file that away.
And I happen to be selling the solution. So
Right.
One of the solutions is
what sorts of things?
Megavitamins.
Which there have been there's no proof that any of that works.
No.
What was it you said? I've been trying to recall back because I stopped taking my supplements after
So most physicians, most healthcare people don't take a multivitamin every day because people tend to have higher all-cause mortality and morbidity those who take daily vitamins.
That's great.
Yeah. And so,
what is it? I'm trying to remember because there's a Health Matters about all of that. And it was folic acid. Acid was the only supplement that was found to have any sort of efficacy for pregnant women.
Yeah. That was it. Now, we're also assuming you, as a consumer of vitamins, yes or no, is an otherwise healthy person.
Right.
So maybe somebody with who had bariatric surgery on their stomach, that's a different situation. But you can go to your own physician or provider and talk about that. But it just seems to me that there is a lack of scientific rigor in this. And patients are ripe for reaching for this because it really does provide something that they want. They want to be understood on the molecular level. They want to have more time, and they want their solution to be relatively easy. And it really, their faces look shocked when I say, well, okay, so your estrogen level is a little different. And it's not, doesn't even have to be outside the range of normal. It just has to be like not perfect.
Right.
And, that's not the problem here. And that's not explainable and probably not significant. Hormones there's thousands of hormones.
Right.
Yeah. So don't tell me your hormones are out of whack. I have no idea what that means. But so anyway, that's kind of what I think this is an evolving topic.
Any sort of insight into how places like the Cleveland Clinic and George Washington University justify having functional medical components?
I think they're meeting, I think probably an administrative person who doesn't really understand medicine probably was talked to by somebody who said, hey, this is going to be a good idea. That way I can practice medicine and I'm not necessarily a medical provider. And
it's just that there are researchers and doctors and other folks involved in these institutions. Somebody has to have said something.
Oh, yeah. This is kind of a hot topic.
Is it?
Yeah, people are arguing it back and forth. And the boundaries have changed a little bit. And so initially the American Academy of Family Practice Physicians or Family Practice Medicine did not give any CMEs for this. And now you're allowed to go to a conference where they talk about the foundational stuff, but not necessarily the detailed stuff, and you're allowed to claim that. So it's evolving. I'm sure there are people who truly believe in this, but they have to understand that this is a different part. It's separate from what you would normally get in the medical field, and if you really think it's going to help you, you'll have to pay for it. And if it doesn't help you, then come on back. We're ready to continue the slog, I guess.
Is there anything to the name? I mean, functional medicine. Does that imply the opposite, that the rest of the medicine isn't?
I didn't see anything.
Okay.
I think they are somewhat trying to separate themselves from alternative medicine.
Okay.
All
right.
So I think
it makes it sound like it's like results based, right?
Yeah, it sounds like a little like physical therapy to me. Actually.
Yeah, right. Yeah.
But I think that's what people want when they have a vague complaint of being tired. What they're really telling you is they can't go through their life in the way they want to, so they want to be more functional.
Right.
So I think that's probably it. But again, super vague.
Yeah.
Super vague, and not. I think part of the vagueness is actually not this branch of trying to look at medicine was not developed by medical people.
Right.
And I think they just renamed everything that we already consider. It's, there's a lot that goes through a provider's brain that we don't comment on.
Yeah. Probably. It's good.
Yeah, we
That's a good
skip
thing. over
it because it burns up time to have to explain, and it's also obvious, It's kind of like I don't have to preface I'm going to show up at 11 on Sunday by saying if the sun comes up.
Wow.
Okay. Stuff like that.
All right. So is there anything you as a traditional practitioner can take away from functioning or functional medicine and take into the exam room?
There's a lot. I have a lot more to learn. I'll definitely say that. I understand the craving of wanting to spend time with patients, and so I'll resist the shortening of visits because I think telehealth is kind of doing that. And visits are already incredibly short. So I'll resist the medical assistants pounding on the door. That means I may be running late more often. Is
that how they come get you? They come pound on the door?
Oh, yeah.
Oh, wow.
They tell me there's a call from the pharmacy.
Oh, really?
And I'm like, what? Pharmacy's not important. Go away. Stop pounding on the door.
Is that code though? Is there really a call from the pharmacy?
Yeah, that's their code, but I don't always like pick up on it right away. I don't care if the pharmacy's on hold.
It's a fire drill, Lynn. Let's go.
So, and I think maybe those things that I skip over that patients don't hear about and therefore have a fear that it hasn't been taken into consideration.
Right.
I'll say, look, these are the components of my decision.
Okay.
So I think you can say that without sounding snotty.
Yeah. You're just letting them into the decision process. Yeah.
Right.
Yeah.
Right.
Yeah, that makes sense.
Reassuring. Yeah. So do we have enough time to talk about another cool thing?
We do. We've got about 5 minutes left, and
Great.
I see the last paragraph here. So yes, let's go.
So this comes from Last Coast Outpost, and there is a pop-up healthcare clinic showing up in Humboldt County on July 12th and 13th. That's a Friday and a Saturday.
Nice.
Put on by something called California Care Force.
The CCF.
Yeah, I've never
who were they?
Never heard of them.
Wow. Okay.
And they're providing general health exams, dental extractions, fillings, x-rays, eye exams, and even glasses.
What?
I know.
So
it gets better.
Okay, keep going.
The doors open at the Adorni Center. Do you guys know where that is? It's by the library.
Okay.
Okay, the county library. Doors open at 7.
So I'm sorry. Please forgive me. In Eureka?
In Eureka.
Okay, thank you.
Yeah. At 7 a.m. Okay.
Wow.
On Friday, July 12th, and also Saturday, July 13th. Now, it is a first come, first served
Makes
thing.
sense. Yeah.
And I imagine there's an end point at some point, although they didn't really say.
Oh, read that last line.
But this is what screams Del Norte to me. You do not need insurance, employment, income proof, residency proof, immigration status, or even ID.
You just show up.
Oh
my God.
So why isn't this here?
Why isn't this all the time?
Why isn't it a thing? They are still looking for healthcare providers and dentists to participate in it. And I I've forwarded on to people that I think would be super interested in it.
Yeah.
And they do also do peds.
Really?
I imagine this is a full spectrum family practice thing.
So pop-up clinic, and this is, at the Adorni Center?
At the Adorni Center in Humboldt County, which is by the library.
So, they're setting up, this isn't a bus. They're like setting up a MASH unit?
You know what this, yes, exactly.
Really?
It sounds like what they do for the veterans every year, although that involves more paperwork.
Right.
And a little bit like what John Med does for Reggae on the River. So it's just, they're there, the right people are there with the right tools, with no rules. Okay, so you don't have to bring paper.
Just healthcare.
And it's walk-in, so you don't have to have a time thing. But if you want a wait list, I would get there at 7.
Early,
I bet there'll already be a line.
Yeah.
And I expect they can't do everything somebody needs done, but they can. My hope is that they have some kind of social worker presence where they can connect people to resources, and that could be helpful. So, number one, I think everybody ought to carpool and go down there and get there right at 6:30 or something,
right?
And then tell them Del Norte needs this really badly.
That's another thing, and I would like to. We're running short on time here, but I would really like to look into the California Care Force and just see if we could drop them a line and say,
I'm kind of like, hey, come up here, don't forget about us, because if I'm passing this along to doctors that are up here or other healthcare people that are up here, I mean, there's interest, but there isn't the logistical part.
Sure, if you can get down there, you don't have to prove you're a Humboldt resident. You don't have to prove you have nothing. You just have to need help.
Yeah, so if you lost your driver's license, in that fire a couple of years ago, then it's okay. It's not a barrier. And the other thing I suspect is that charting will be pretty minimal. So the providers are going to be way into that.
Yeah. Now, boom.
Yeah.
All right.
Like Reggae on the River, they don't chart. So
that may be, we may need to send Redwood Voice down and find out more about that, because it sounds, wow. That's
I know.
impressive. That's really cool. I'd like to know more about that.
It would be nice if that was printed in the Wild Rivers Outpost.
Oh, hey, Jessica.
Hey.
Okay.
Little shout out. So,
Lynn, thank you very much. That was very informative, and I'm super stoked. Now, we're not going to record next week, correct?
No,
Okay.
we're taking a vacay.
Yeah, a little 4th of July break. Okay, but we'll be back a week after that. And, of course, you hear Health Matters on KFUG, but nowadays you also hear us, I believe, twice a week on KZZH in Eureka, KZZHLP. So dial them up and check them out.
Yeah.
Lynn, thank you.
You're welcome.